The porphyria is definitely worse than the cancer. It takes everything from you. The porphyria took everything from me. You cannot sit back and just let your doctors walk over you and say that, no, this is all in your head. Porphyria is a serious thing. People still die from it.
What piece of advice would you give those people after just going through what you've been through?
You've got to set goalposts for yourself. For one, you need to have something that you're working towards.
There's so much to unpack. I mean, there's just such a journey.
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts, Andrew McManamon
and Nicole Castellano.
We have porphyria, a rare disease. Rare diseases differ greatly, but share many similarities in how they affect our lives.
Being rare can feel lonely and isolating, but we're stronger together. Join us in meaningful interviews with porphyria and rare disease experts and the patients and families impacted as we connect, learn, and heal together.
We'll talk diagnosis, treatment, pain, mental health, managing daily life, and everything rare.
Welcome to episode number 15 of the Rarely Discussed podcast. Today's guest is someone who truly defines resilience, I would say. Someone we'd call a medical hero, and I know you're probably way too humble to admit it, but in the porphyria community, we're just such a small piece. And when you think of these, what we think is small commitments, not really small commitments, it means the world to us as patients because it pushes the envelope to better treatments and things like that. Mike Boone was diagnosed with acute intermittent porphyria back in the early 2000s, but it wasn't new to his family. His great uncle, grandmother, and mother were all diagnosed before him, but it didn't really make it any less overwhelming. And after experiencing repeated attacks and struggling to figure out how to support his family, Mike found the American Porphyria Foundation, which connected him to Panhematin, a treatment that finally gave him some relief. And then from there, he didn't just focus on his own recovery. He started giving back, joining multiple research studies to help advance treatment for others. He even flew to Texas for a double-blind clinical trial, not knowing if he was getting a real medication or a placebo. Eventually, he got access to Givlari, a newer treatment that helped reduce his attacks and allowed him to get his life on track. Recently, Mike was hit with a new challenge, a cancer diagnosis, and even now, he's facing it with the same strength and determination he's shown all along. I'm so beyond honored to have him here today to share his story. Mike Boone, welcome to the Rarely Discussed podcast. How are you?
I'm doing well, thank you.
Well, I'm so appreciative that we could get this on the calendar and we could chat more about your story because there's so many pieces to it. Like when I first came along to see your story, I was like, I don't even know where to start here because there's just so much to it. But I thought we could rewind back to either what your journey looked like prior to the 2000s, to you getting diagnosed, or even to what it looked like prior to that, you facing symptoms and how your family faced it, being as so many people in your family have it.
Well, we didn't have to do a lot of facing, I guess. My great uncle passed away. I think it was in the late 50s. My grandmother passed away from AIP I think it was 1964. Then things kind of got quiet. My mother was finally diagnosed in about 1995, and then I started having symptoms around 2004. And even with all of that, we really didn't know much about it. I didn't understand how I should be tested, so I got kind of a delayed diagnosis for part of that because of what all was going on. I started having those symptoms in 2004, and we thought it was the gallbladder because my symptoms were the upper right quadrant. And so eventually, they did HIDA scans, found my gallbladder was draining slow, and just finally decided, I said, just take it out. I can't keep doing this. I got to work. Mm-hmm. So we took it out, and unfortunately that did not fix it. So the next 4 years I went through some on and off attacks. They never really got that bad until about July of 2008. I got really dehydrated at work. I'd forgotten my water that day, and it was a hot day. And that finally set it off to where it was pretty nasty. And it took until October, several trips to the ED before people started listening. And prior to that, they had sort of listened, decided, well, yeah, maybe we'll rule this out, sent me to a GI doctor, but the GI doctor didn't test me correctly. We didn't do the 24-hour urine collection while I was sick. We didn't realize that had to happen. So of course that came back as, my PBGs being normal, which really sort of threw me for a loop, threw everybody else for a loop. And that kind of delayed realizing that, hey, we did this testing wrong, that we need to try this again. And then finally a physician's assistant in the ER in our local hospital said, I'm beginning to think that maybe you're right here, that you do have this. They sent me home for a 24-hour urine collection. I collected that. Then I think, I don't know, a day or two after that, I got really sick again. They transferred me to another hospital where they did another 24-hour collection, and both of those came back with my PBG quite high. So I finally got a diagnosis, which I thought, yay, we're gonna be able to get this treated now and figure out what's going on, and I'm going to get better. And boy, was I wrong. Because after that, the challenge was finding a doctor who knew what they were doing. I went to a GI doctor up at University in Denver, and he didn't really know what he was doing. And of course, at that time, I still didn't know anything about things yet. I had found the foundation at this point, and I'd found the NAPOS drug list. But I was not really checking the list. I had expected the doctors would be doing that. And he put me on a medication that at the time was labeled as dangerous for porphyria, and that really made things worse. The pain, neuropathy in my hands got so bad that finally I got him on the phone and I said, look, if, he was him-hawing around about treating me. And I said, look, if you don't want to treat me, that's fine. I understand. Just send me to someone who will, because I'm telling you right now, if we don't do something, I have a plan to cut off my hands because they hurt so bad. I can't take this anymore. And he finally took me serious and said, all right, I'm going to send you over to a hematologist who deals with this more often. And of course, my initial thought was, why weren't we doing that in the first place?
Right.
So I went to see this hematologist, and I said, what I want to do is I want to do D10 twice a week, and I want Panhematin, because this other doctor, he wouldn't even give me Panhematin. He said, we don't do that here. And I'm like, this is University Hospital. What are you talking about? You don't do that here. This is supposed to be like the premier hospital in the state. So I went and saw this hematologist, and I told him what I wanted to do. And he said, that's actually all perfectly reasonable. Let's start it. And so I started doing D10, and I started doing the Heman, and it helped. It took me a long time to kind of somewhat semi-recover, but it did help. So over the next few years, I continued to try to work as much as I could, which, there were some difficult days. I needed Panhematin more often and more often. I was doing the D10 twice a week at home, and what I had an ambulatory pump that I just had in kind of a backpack that I wore to work. And I had my initial port put in February of 2009. So I would access myself at home, start the D10, go to work twice a week, wear that. And it actually helped a considerable amount. And I think part of the reason it helped so much was it helped me keep up with my hydration as well, because hydration is a huge trigger for me. If I don't stay well hydrated, I get myself in trouble. So by 2014, the Heman wasn't helping as much as I'd hoped anymore. I was doing it 4 times a month. We tried doing it once a week. We tried doing it 4 days in a row, and it wasn't doing anything anymore. And it was around that time that Recordati had changed the dosage. I think it initially was 313 milligrams, and they changed it to 350. And when they changed it to 350, the side effects got way worse. I just kind of was at the point to where I couldn't work anymore. I was on so much pain medication all the time that I finally, I worked for the family business, and I ended up hospitalized twice in August of 2014. And I told my dad, I can't do this anymore. And he said, I know. So I quit work and applied for disability. And surprisingly, I got on the first time. I didn't have to get a lawyer or anything like that. I was approved immediately, after my 6-month waiting period, of course.
Right.
So after that, it was trying to adjust my life to living on, what little bit of disability money I got, and just being miserable day in and day out. My PBG was always elevated. I had a base PBG in the 60s. When I would have a bad flare-up, then I would be into the low 100s. So it was my new normal was to just be miserable all the time. And I had goals, where I wanted to see my kids, get into college. Then it sort of became, well, I want to see them graduate. And then it got to the point that, I want to see my daughter get her driver's license. And I went into the hematologist one day, and he said, "Look, we have to get you a liver transplant." And I thought about it, and I felt like I was only going to be trading one disease for another. And so I called the case manager at my insurance company. I talked to her about it, and she said, "Yeah, we'll do that. We can try and get you on the list." I didn't know all the ins and outs. I kind of found out later that it probably wouldn't have gone well for me, that I would have needed to find a live donor for that. But I was going to have to go to Arizona for the transplant because my insurance company wasn't contracted with the university anymore. I thought, okay. So I asked her, I said, "So how is this going to work? You find a liver, we find somebody to donate, and you only have so much time for me to get down there." And she said, "We will fly, a med flight jet straight to the airport where you live and take you down there." And the more I thought about it, the more I thought I don't feel like this is a good idea. I'm going to be down there for who knows how long before I come back home, then I'm away from my transplant team. And at that point, I was slowly giving up, I guess. And I finally said, I don't think this is a good idea. I don't think I'm going to do that. We don't know how long I really have for sure. We know things are getting worse and worse, but if I get a liver transplant and I reject it, that's it. It's done. So I was really glad I made that decision, because then a short time later, I had been in a Panhematin study down in Houston with Dr. Anderson. And then I found out, I think it was Desiree called me about the Givlari study. And so I called down there and asked some questions. And they said, "Well, we're full right now, but we are going to put you on our list. So if something changes, we'll let you know." I don't know. It might have been a week later. They called back and they said, "Well, we have a place for you. The other person didn't qualify." So I flew down, and there was, I think for 2 months, I had to go through where they just observed and did testing and whatnot. And then we started phase one. Phase one was a little bit rough because, yes, I ended up being the placebo. So,
Of course.
when I got the first injection, for the first month, I had to fly down there weekly. And then after that, it was every other week for 2 months. And then after that, it was monthly. When I got that first injection, somebody said, "Did that burn?" And I said, "No." And they said, "And I thought, crap, I just got saline. So but those studies, having a placebo patient is very important. It's extremely important for those studies. So at that moment, I made up my mind I'm going to persevere, but I didn't realize how sick and miserable I actually was going to get. It was pretty miserable. I would drive to the airport in Denver from Brush, which was about, 60, 70 miles. But when I would get back, I'd be so sick and worn out, I couldn't drive back, and somebody would have to come get me. There'd have to be 2 people come to get the car. So the pharma company arranged for me to have a driver, and they would take me up and pick me up and bring me back, just like what they did in Houston. So that helped tremendously, and that's part of what helped me get through that first 6 months of that phase one. When I got into phase two, things got considerably better because I actually started getting the medication. Prior to that, I was taking OxyContin in the morning, and then at about 1 o'clock, I'd have to take another oxycodone. And then around 4, I would usually have to take a Dilaudid because the pain was breaking through, more than what it normally was. And then when I would go to bed, I would take an OxyContin. And sometimes in the middle of the night, I'd have to wake up and I would take some more Dilaudid. But after I started the Givlari, second month in, I was able to quit all of my pain medication cold turkey. I just stopped it. I hated this stuff. I couldn't think on it. There were times I would, have to tell my wife that I can't have this conversation right now because I can't process what you're telling me. I don't understand what's happening. So I got off of it, and for about 2 days, I just felt like I had low blood sugar, like I just needed to eat a little bit of candy, and that was it. Was over. I really didn't have much withdrawal symptoms, which frankly was amazing because I'd been on it like that for years. But one thing I always did was I was in palliative care, and we always worked hard to keep our doses low and to keep a little bit in my system all the time, which we had to do some workarounds with the insurance company because of the way they wanted to pay for the drugs. But we were able to do that. And that really, I think, working like that was a tremendous help for me being able to get off the pain meds without all the severe withdrawals. So I continued to do that study once a month until, it was approved. I went all the way even into, I think my first dose, I want to say was May 2016, something like that. And I kept flying down there monthly to get this shot. Things were going well. I was improving. My PBGs went back down to normal levels. I wasn't sitting at that baseline in the 60s anymore. I felt quite well. In the middle of all this, my marriage fell apart. I ended up getting divorced. But I moved to Denver and I went to school and got my degree in respiratory therapy. And the school worked with me on my travels, being able to go down to the study site still. And then COVID came along. So the study site was shut down, and home health came in and they just did the shots for me at home. So I didn't have to fly down there. And I finished up with the study just before the FDA approved it. They continued to give me the shot until it was, approved and I could get it privately. So that was a very interesting journey. I went to Boston twice. We did a photo shoot at one point. I'm in some of their educational materials. I spoke at their annual meeting. I also spoke at an annual meeting for another pharma company. I think the name of it was Ironwood. I can't remember the name of that company now. And then when they did their launch party in Austin, they also flew me there to speak there. So it was quite the experience. It was something that I really enjoyed doing, and I'm glad I did it. I hope that it helped a lot of people as much as it has helped me, because it changed my life. It really changed everything around.
There's so much to unpack. I mean, there's just such a journey. It's just, but I think if someone's listening, they're probably thinking, wait a second, you're using Givlari and you're using Panhematin, because when you touch the surface on the study of Givlari, you're thinking that's the miracle drug, that's the cure to porphyria, and that's what everybody thinks. So I'm curious just to have your insight on the combination of needing Panhematin and Givlari and how your experience was with that.
So the Givlari has worked very well for knocking down my constant attacking. There are still sometimes things that happen. I might get exposed to something that sets it off. I might get too dehydrated. I get some symptoms. My new challenge that I've got is with this cancer diagnosis and the chemo. The chemo is supposed to be safe, but I don't know if the chemo is directly setting things off or it's the stress in my body that's setting off the porphyria. After my first week of chemo, the way it works is there's one chemo, and I can't remember the name of it, that I get on a Tuesday, and then I get a bolus of this fluorouracil, and then I get a infusion over 46 hours of the fluorouracil. The chemos that I'm on are listed safe. I don't know if it's just the stress that is putting my body through the setting off the porphyria, but I can tell you this. After the Givlari, the nature of my attacks changed. I don't have near as many, way down. But the symptoms have changed. I don't get the classic abdominal pain like I used to. I get more neuropathy, which I hadn't really had severe neuropathy in a long time. I'd have some minor flare-ups that maybe I'd just get a dose of Panhematin and it would knock it down. But it's not as bad as it used to be until this chemo thing came up. So my first week of chemo, I came off the pump on Thursday because I take a pump home that they pump this other chemo in. And then Friday I woke up and I was just exhausted and not feeling well. And then Friday night I started having a lot of the neuropathy that I get in my chest with the porphyria attacks, and in my ribs. And I kept thinking, this is gonna, go away. It's just gonna last a little bit, but it kept getting worse and worse. And finally I thought, well, I have to get ahead of this. So I went into the emergency room and they ended up admitting me, and I got 3 doses of Panhematin. And I want people to understand that just because the Givlari knocks it down doesn't mean you're not going to have attacks. Some people will still have some attacks. Like with every medication, it works a little bit different with everybody. Some people it works really well with. It worked amazing for me, and it has completely changed my life. Some people it doesn't work quite as well with. And I wonder if part of that is because I'm a male and I'm not going through those hormone swings like some of the women still are. Mm-hmm. But we have doctors out there that are saying that, well, once you get the Givlari, you don't need Panhematin anymore, and that's really not true. The nature of the attacks have changed. My symptoms have changed some. But if I don't get the Panhematin, that attack sort of stays in force. If I get the Panhematin, it knocks it down. My symptoms go away. So there still is a need for the Panhematin.
Gotcha. And you would say that they work pretty well together then?
Yeah, they
Has there
do.
been any butting heads of symptoms to either, or?
No, not really. It, the Givlari, I think, changes in the nature of the symptoms, keeps it from getting terrible. And the Panhematin will come in and kind of knock down what it is. And I've spoken with some of the experts about this, and their thinking is that there just is a mechanism that we don't understand yet, we don't know about yet. And the Givlari's kind of uncovered this, which is a good thing because, the more we learn, the better we can treat this. And now it's going to be a matter of discovering what else is going on here.
Right, right. Something I wanted to talk about to switch gears a little bit, because I mean, obviously we're like 20 minutes into this conversation, and it's clear that you've just been through a lot. I mean, that's no secret. Your journey has been just too much, really. I mean, that's the easiest way to say it. And something I want to touch on is just the mental health aspect of it, because I mean, it just seems like every time you try to get up, you just keep on getting hit down with something else. I mean, you have this cancer thing, you have these trials. Of course, you get the placebo. Of course, you have this and this and this and this. And I just want to take a deep dive into your brain a little bit and just see a little bit on how you deal with things like that. What do you do when it hits you?
I don't know anymore, really. It's sort of, initially, like I talked about earlier, I had these goal posts that I had set, for things for my kids, but they're grown now. My daughter's in college. And so I sit and I look at what is the goal post that I set now. And I haven't been able to figure that out yet. Ended up being diagnosed with chronic PTSD, and it wasn't just from the porphyria. I was in EMS when I was younger and saw some, horrible deaths, and had a workplace accident where someone was killed where it really should have been me. And so living with the guilt with that, it was, that was part of the stressor too, that set off the porphyria. And so dealing with all of those things, and then having all of this medical PTSD from, being so sick and terribly, horribly sick for so long. I don't know. I don't know how I kept going. It was, the effect that it has, it takes everything from me. The porphyria took everything from me. And I don't know, it's something I'll never really fully recover from. I had to stop working in the family business. Eventually, my dad retired, sold the company. My grandfather started that business in 1950, and he just sold the company last year because there was nobody left, to take the reins and go on anymore. So I can't go there because I can't afford insurance. I have to work for a larger company that provides employer insurance because there's no way I could afford the insurance the way things are with me. I mean, the Givlari is pretty darn pricey to get every month. And then now with the cancer and adding the Panhematin on top of that, my insurance company would probably like it if I just went the other way and left them. But I suppose there's just, I don't know, a will to keep going for some reason. And I don't know why anymore. It's something I'm at a point that I really can't answer. What keeps me going?
Yeah. I mean, I think it just gets to a point. I know we talked about it a little bit on the phone the other day, but it just gets to a point where you're just knocked down and you just get up and you're like, what else can throw at me? But you just, of course, like you said, you have that will to keep going. And I know getting a little bit emotional talking about the kids and having the goalpost and the driver's license and just those checkpoints that every father, every parent should be able to see their kid go through and accomplish. I think that was probably the earlier goalpost for you, but now I can see how that would be a little bit shifted now that they're grown up and they're moving on and creating their own lives. But with that sense, I mean, are you able to create space from porphyria at all? I know obviously with the frequency that attacks happen and everything you've been through with porphyria, have you been able to just say it doesn't define me? Are you able to create that space from it, or has it's just every day just feeling like,
after the Givlari, I was able to create that space and say, this doesn't define me anymore. I'm doing much better again. I was able to go to school to get my degree, and I work in critical care now part of the time. And So it's something that has made me happy being able to go and help other people. I, I, I don't know why, but that's sort of what drives me. Um, Now with the cancer diagnosis, it was just, first I was just kind of in shock. I was like, "Are you kidding me?" What?
Mhm.
No,
Yeah.
I've had my battle. Why do I have to do this again now? Um, and I suppose just it's what's expected. People expect you to fight and to move on,
Mhm.
and I don't know how to. I guess I don't know how to tell people that I don't know. I don't know how long I'm going to go on with this. It depends on how sick I get, quality versus quantity kind of a thing. And this is definitely something that is curative, but I've already had my battle. And I don't know how much longer I can go through this battle if the porphyria is going to keep going along with all the side effects from the chemo. So I, I don't know.
Is there a part of you, because I mean, at least for me, because I was in a family of five boys, so I'm one of the five boys, and I have a twin brother, fraternal, and he doesn't even have porphyria, which is just wild to me. But I feel like when I got diagnosed and I was having these attacks and just going through it, I just had this feeling, well, at least it was, I mean, it's sad to say, but I just always said in my head, at least it's me and not them. And I don't know if that's something that you've ever thought with your extended family, where it's like, if it had to be anybody in my family, like not my kids, not my spouse, not my whoever, and I was like, at least it's me, and I will truck through it. Is that a feeling that you have at all?
Yeah, I mean, yeah, it was, especially with the porphyria. Because I just felt like I can push on, I can go through this, I can keep pushing and pushing. Um, it's it's something you definitely don't want to see other people suffer through. It's something that people don't understand until they suffer through it. I
Right.
can't count how many times that I was told that, well, at least you don't have cancer. And I'd love to go back and see those people now and tell them, well, guess what?
Yeah, I have
And
both.
yeah, so far, the porphyria is definitely worse than the cancer. Um, I feel like the side effects from the chemo aren't as bad as what the porphyria attacks are. So if the porphyria would just stay controlled, I'd be okay. I'd be like, okay, I can do this. But if it's going to keep flaring up and causing problems, then it's more of a, well, I guess here we go again. It's, time to really dig in and fight this battle.
Hmm. And obviously, we've touched on a lot that it's been quite a journey, and then with cancer now, and I know you were briefly touching on getting your degree and going back to work part time. How was that for you? I mean, to get the motivation to be like, you know what, I'm going to go back to work. I'm going to get a degree, and I'm gonna make this work. How was that process for you?
I had always wanted to go back to work. I absolutely hated being on disability. I didn't want to be tied to something that, was going to hold me in one place. I could never advance. I could never move up. I was going to be dependent on the government to pay my bills. I did not want that. I absolutely hated that. I despised it. So when I got a chance to go through the Ticket to Work program and go back to school, man, I lunged at it. And I looked at around a few things. Initially, I had started with cybersecurity, but it was just so boring. A year into this, I was like, I cannot do this. This is not me. This is way too boring. So,
Hmm.
I looked around. I thought about, getting my associate's degree in paramedicine, but I looked at what that paid and it was absolutely disgusting. So I said, well, I'm not going to do that. So I went to a school and I was looking at a surgical technologist because I thought, well, that'd be cool to do. And they said, well, have you considered respiratory? And I kind of thought, well, no, I'm not really even sure what they do. So they ran me through the program and what they do. And I was like, okay, yes, I can do this. I like this. And so I went through, it was actually an accelerated program and it was pretty stressful, but, I got through it, graduated, with, I think I had like a 3.9 or something like that. I was just shy of a
There you
4,
go.
when I did my exams, I did very, very well in my exams, got my license and went to work. And I've just fallen in love with it. I absolutely love it. It's one of those, um, jobs where there's not much of a ladder to climb. You can go laterally a few places, cath lab, a few things like that, but it's you're not going to go very far up the ladder. But I enjoy it. I enjoy doing patient care and taking care of people and caring for them and saying, hey, you can get through this. We're gonna do this. There's always the times where people aren't going to get through, and you have to be caring and compassionate as you can and sort of help them to make that transition. Those are some hard days, but you still push forward and keep going, and I look at some of those cases and I think that, this person's extremely sick. That was me at one point, and I pushed through and did okay, and maybe they will too. So I've enjoyed it. I just love it. I love helping other people. And I suppose that's the one thing that has kind of helped me look forward to get through what's going on now. Because I'm out of work for, they said, probably 8 months. They said to expect to be out of work. So I'll be definitely missing that. I'm already missing it. I've gone over a couple times and had breakfast with the crew because
Yeah.
when I get ready to do my chemo day, I go over like, I'm here to have breakfast with you guys. I'm going to go do my chemo then. So I miss it, and I miss everybody over there. I have some great coworkers there. They're wonderful people over there.
That's awesome. And I wanted to touch on too, and I almost wish I would have got it on camera when we were talking before this, but you were just mentioning about your journey of being diagnosed with cancer too, and jumping from doctors and them saying this and them essentially giving up on you. And that's something we've reiterated on several episodes with porphyria, because obviously nobody even cares to learn about it, and everyone gets pushed aside, like you're drug seeking, you're whatever, you're not feeling this, whatever. So how much has dealing with porphyria helped you just push and keep pushing for your cancer diagnosis? Because I heard it in your voice a little bit of just the irritation and you just having that voice to push. Because I know I talked to you a little bit about my dad's cancer diagnosis and just me being on the sidelines with him and my mom and my brothers and just talking through that and just being like, you got to do this, you got to do this. And it just all stemmed from having to deal with the doctors and everything with my porphyria. So could you touch on that a little bit for you?
Yeah, I can. The porphyria, for one thing, taught me you have to advocate for yourself. And that's even more important these days with the situation that our healthcare system's in. There's not enough doctors. There's not enough nurses. There's not enough respiratory therapists. It's just, we are in a bad state. And the people who don't have to use the healthcare system so much don't realize how overloaded the system is. So you have to really be able to advocate for yourself. When I saw the initial nurse practitioner in last fall, my symptoms were kind of dismissed. And at the time, I didn't think that it was cancer. And I got frustrated and irritated, and so I just didn't go back for a little bit until things started getting considerably worse. Then I went in and I saw a PA, and they sort of fought me on this again, continued to tell me I just had hemorrhoids bleeding, and kept coming up with all these excuses, and I countered them. Finally, I said, you are going to scope me. I had to stand up and say, no, this is what is going to happen. And so they relented, and we got the scope and found that, oh, whoops, there's cancer in there, which was a bit of a shock to me as well. I didn't think it was going to be that. I thought something else was going on, but you cannot sit back and just let your doctors walk over you and say that, no, this is all in your head. Porphyria is a serious thing. People still die from it. It's not that often, but it's also a rare disease, so that's part of the reason it's not that often. Suicide rates, from what I understand, are still up with it. So when you go in and somebody tells you it's in your head and it's not, you have to advocate. I went through quite a few doctors before I finally found somebody who would treat me initially. In fact, the insurance company even got mad at me and said, you've seen enough doctors. And I said, I've not seen anybody yet who will even treat me, so I haven't seen enough doctors.
Right.
You can't sit back. You can't. Reach out to the foundation. They can help you find a doctor who will help you out. And even then, sometimes you've still got to be prepared when you go in with the treatment plans that you want to do and why. If you're reasonable with them, a lot of times they will sit down and they'll listen to you and say, okay, we can give this a shot. At least that's been my experience anyway.
And speaking of the American Porphyria Foundation, because I know you got pretty, not early, but sort of early into your journey when it came to porphyria, but how has that helped with your journey? Because at least for me, when I figured out, oh, this porphyria thing, didn't know anything about it, found the foundation, I'm like, oh, wow, there's a whole community of people here I can talk to. So how was finding the foundation, how was that important for your journey with porphyria?
Well, they helped me figure out how I needed to be tested properly in the first place because I didn't, know that stuff. And they did help me learn a lot of things about, treatment protocols, things to watch for, different symptoms, because I was still learning in those early stages about what all it can do. So I was missing some of those early symptoms. Like I would start getting irritable for no apparent reason. And I learned later on that, I started putting two and two together and realizing, oh, there's an attack coming on. That's why I'm acting this way. There is no reason for me to be acting like a jerk like I am right now. What is going on here? And it was the porphyria, sort of affecting me mentally and just making me a jerk, really. um, so once I started figuring out those, early symptoms and things, I was able to start, increasing my carb intake, things like that, and then start watching for some of the earlier signs of the pain coming on, and then getting in and being able to get ahead of this attack. Because that's one of the important things, at least for me, is when I start having the attack, don't sit around until I can't handle the home anymore and then go in because it's too late. Try and get in and get the heman, get ahead of this thing, because it takes a little while for that heman to kick in through that feedback loop. So there were things like that I learned. I learned experiences from other people, what medications set them off. I learned about, the safe and unsafe drug list. Just generally other people's experience with doctors. And they also helped me find physicians and get into these studies as well.
Yeah, and I think when we talk about finding your voice with healthcare, I think that's something at least I can take from talking to people with porphyria in the community at the foundation with is I just say, hey, this is happening to me, or hey, I have questions about this, and everyone's like, yell at your doctor, advocate for yourself, do this, do this, do this, and it's been such a huge help there because you can actually relate to people that are feeling the same way with you. But something I wanted to talk to you about too is just how you are present day. I mean, cancer aside for a minute, would you say that you've kind of nailed down your process, like the carb loading, not stressing out too much, making sure you're hydrated? Like what does that look like for you now?
Yeah, I think so. I have a hard time staying hydrated at work, especially on our busier days. So I really try to carry bottles of water with me to keep hydrated. The stress sometimes is not avoidable, but I've learned sort of how to deal with it and de-stress. I don't do so much of the carb loading anymore since I have the Givlari. We did try last year to sort of stretch out those time between Givlari treatments because I was doing so well, and that didn't work so well. I ended up having to get some heme and had some flare-ups, and so we're just back to just getting it monthly. Just keeping an eye on that and seeing how that goes. So, and it's going to be a little bit different for everybody because their situation's different. Some people, are never going to be able to go back to work. They're going to constantly still have some flare-ups. They're going to still have some permanent neuropathies and whatnot. So it's going to be a little bit different for everybody. But for me, I was blessed and being able to come through it and come out the other side and, have Givlari and have heme and have a heme oncologist that, listens to me. And when I feel like I need heme, they just, okay, we'll get you in and we'll get it done. Those kinds of things. So I've been very lucky there.
That's good. I know it just takes a long time, and I've heard of people. We've had some guests that have journaled and just kind of figured out where all their attacks have come from, and was it stress? Was it dehydration? What was something that caused that? And something I wanted to ask you too is if you were to give advice to somebody, maybe someone's listening now and maybe they're at the beginning of their journey, maybe they're even at the middle, they're towards the end, I don't know, whatever it may be. If they're struggling or just whatever it may be in the process, what piece of advice would you give those people after just going through what you've been through?
Well, you've got to set goalposts for yourself. For one, you need to have something that you're working towards. sometimes that can be hard to set, and I understand that.
Mhm.
Keep track of anything that you think may have triggered it. Try to avoid those things. Keep an eye on that safe, unsafe list for medications. There's the foundation has one, NAPOS has one. Um, Always check. Don't trust your doctor to check. Always check yourself. Um, Eat healthy. Try to get some exercise in when you can. You don't want any other complications coming up like heart failure and those kinds of things. So try to keep an eye on other things as well. If you're not an overly active person and you're gaining weight, keep an eye on the blood sugar. Make sure you don't end up developing diabetes. That's also another thing I'm fighting now as well with all the steroids and everything I'm getting with the chemo. I was pre-diabetic, always kind of right in the edge, and now it's finally sent me over. So I'm dealing with that as well. Um, Advocate for yourself with your doctor. If your doctor's not listening, get a hold of the foundation, see if they can find you another doctor. It's important you have a doctor that's going to listen to you and understand. And one of the things you can do is see if they're willing to consult with an expert. Talk to the foundation, get an expert that they can work with to work with your doctor, so they can say, hey, well, maybe you're thinking a little bit wrong along these lines. Get somebody who knows this disease involved and give your doctor some advice on what should be going on.
That's good advice, I would say. Well, in terms of just the conversation we've had today, is there anything that maybe I didn't touch enough on that maybe you'd want to bring to light somewhere at all?
I'm not sure, other than with the safe, unsafe list. I'm a person who's really sensitive to some of those medications. Excuse me. And so some of those medications that are listed as safe, I know have set me off in the past. So if you come across a medication that you've started a new medication and all of a sudden you're having an attack and you can't really put it on anything else, stop that medication, talk to your doctor, see if maybe that's what's going on, see if there's an alternative for you. There is an app out there that I use called Hippocrates that, of course, I'm medical, so I'm a little bit more into this stuff, that I use to look at, the pathways through the liver that a lot of this stuff is metabolized. And so there are some medications that I look at, and I look through the specific substrates in the liver, and I go, no, I'm not touching that one. We have to find an alternative.
Yeah, that's a good one, because I think sometimes, I mean, when you're in so much pain and you're dealing with this and you're dealing with that, sometimes it's easy just to grab whatever you can find off the shelf without even thinking about it. And I think the safe, unsafe drug list is something very important. But like you said,
Yeah.
I mean, everybody's different with this stuff, and
Yeah.
maybe that's set on a certain standard, and it just didn't mix right with whatever you're doing. So definitely, I would say, is a very, very important thing to touch on. But I wanted to, before we kind of wrap up here, I wanted to just nail home how much of an advocate you've been for the Porphyria Foundation and for the whole Porphyria community altogether. I mean, what you might feel is small, and all the stuff that you've gone through that maybe you thought was behind closed doors, is something that we definitely see as a community and has helped, I believe, pave the way to the treatments that everybody's getting now, and it's working for them. I mean, without somebody like you being able to bite your tongue and take a placebo, obviously you didn't know, but you signed up for it. It's paved the way to just the treatments in such a rare disorder. And I can't say it enough to you, but I know everybody else would say it that's listening and watching this, that we appreciate everything, and we're grateful that you jumped in and made that sacrifice, and you're willing to share your journey, because I'm sure it's probably not the easiest to tell.
Well, I wasn't the only one on this, and there's been a lot of pioneers before me. I mean, you look at Desiree, I believe she was the first person who got Panhematin. So, she's been out there pushing for all of these years, pushing to help people. And I appreciate what she's done. She sort of paved the way for the rest of us as well to come through and, continue her journey and to continue improving things for everyone so that we all can have a better future. And tell you, I keep an eye out for other studies that, is there a chance that there's something else I could be doing here? Because there's still a better future to come for us. There's hopefully a company working on some gene editing that, hey, that could be pretty promising too. Hopefully that turns out and works out for us, that they'll take a look at our disease and say, hey, let's do this. But we do have a brighter future because of all this technology that's coming out, and these pharma companies, they're coming up with some amazing things, and they're going to help us out.
Mm-hmm. And even when I kind of started this journey too in 2018, I feel like we've come so far too. I think at least for me, I feel like the conversations have been a little easier with healthcare. It's still difficult, of course, but it's just, I feel like there's been a little bit more of an openness. I feel like some of the medical staff have actually heard of it. I mean, I was diagnosed by a PA too, which is just, people just say it's crazy because it's like, why didn't the doctor think of that? But
Yeah.
it's just, I mean, I know that porphyria was a paragraph in a textbook and that's all it was. And now I feel like we're making some ground, creating awareness. And that's when I'm so happy to see what the future holds, because it can only really go up from here. So,
well, and I'll tell you, I have to give a shout out to the residents at the hospital where I work, because I've had a couple of times where I've thought, I am kind of suspicious this patient might have porphyria. And I talk to them and they say, that's a good thought. Let's test for it. And they listen and they test for it. Haven't had anybody come up positive yet, fortunate for that patient, but they listen. And so there is a movement out there to listen more, and it is being discussed more and more. So I think part of that is education from pharma companies and better education in schools, just being out with it in social media more, people run into it more. So I think things like this podcast actually have a real impact on that as well.
Yeah, and it's crazy too, because obviously we're very quick to get irritated with the healthcare system when they're not listening, but I feel like we don't give enough praise to the difference that the staff makes while you're in the hospital. Because even for me, not having an overwhelming amount of attacks, but at least in the ones that I've had, there's been such a huge difference from being there and having the nurses that are either like not willing to do something, or the ones that are like, I'm front and center, what do you need me for? And I think that can go a very, very long way. And I feel like we don't praise them enough, but we definitely need to start if not. So.
Oh yeah. The nurses I've worked with have been great. Whenever I've been in the hospital, they come in, they're like, so they tell me you know how to do this, and I've never given this before. Why don't you walk me through this? Because pharmacy will tell them, hey, he's an expert at this. Just talk to him. He'll help you through it. So that's something that's been wonderful and amazing too, is that, the staff listens to you and helps you out that way. It certainly makes them more comfortable.
Right. And just the fact that they're willing to admit that they don't know, and they're listening to you who's been through the process. And I think that's probably the biggest battle that we face, is there's just the ego aspect of these doctors.
Yes.
That are like, I know it. I went to school. You didn't. And it's like, well, I've been through this a billion times and I know exactly how it works. So it's nice to have nurses and people that will actually set that up and just say, hey, how do I do this? Because I've had people, set up the Panhematin wrong, or not do this, not do that. And it's just, I've had them put it through a regular IV and I've gotten blood clots. And
that's
so I was like, you know what, you're going to give me a PICC line, because my attacks weren't so frequent to where I'd need a port. So I was like, just give me a PICC line. They're like, why? Why don't we just alternate arms? And I was like, just give me a PICC line. And they eventually just listened.
I've had it through a peripheral vein as well, and they gave me phlebitis, and I just won't allow that again. I'm like, no, that's not happening. So, one of the things that I guess one of my sayings is that I say, look, I understand the doctor's the conductor of the symphony, okay, but I've been playing this song for a long, long time, and I know it better than anybody here. So please just listen to what I'm saying.
And it's not so cut and dry. I know we obviously have the doctor packets and the guidelines, but at the end of the day, if you've been through it a bajillion times, the little tweaks that have to happen to satisfy your attacks and make you feel good. So, but yeah, I thought, I can't say how grateful I am to hop on a call with you. And I know Desiree was bothering me. She's just like, you need to get Mike on a call ASAP. And I was like, yes, ma'am, I'm getting him on. So, I appreciate it greatly.
Well, I thank you for having me on and being able to tell my story. It was a long, drawn-out thing.
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.